Hello, healthcare leaders. Dr. Jim here. I have a good topic for you because this has been a struggle for a long period of time. Employee turnover, retention, and the struggle to maintain direct care staff. Now, we've lived through and continue to some degree live through a pandemic. Did we learn anything through the pandemic about maintaining direct care staff? I thought about it, I thought it through, I researched it, and I'd like to share some of my findings with you. Today, there are nearly 4.6 million direct care workers in senior care. That is an army of people, including state-tested nursing assistants, home health aides, and personal care aides. Surprisingly, almost 2.5 million work in home health, partially due to the desire to keep seniors out of long-term care facilities post-COVID-19. The remaining 2.2 million work in assisted living, personal care homes, and skilled nursing facilities. Now, direct care staff play a critical role in providing the hands-on care and daily support to older adults and seniors who are living with chronic illnesses, cognitive loss, and a variety of disabilities. The struggle to keep competent direct care staff is nothing new and has been one of the biggest challenges in senior care for decades. I have a lot of experience in this area. I started consulting a very large company a decade and a half or more ago, specifically to slow down turnover, get to the heart of the matter, the heart of these direct caregivers, figure out what they were lacking, what they needed, what they wanted, what they didn't want, and we started to see people stay longer. So it can work. Now, many challenges face leaders in senior care, leaders like you, including low wages, limited training, high turnover, poor career development opportunities for STNAs, and an increasingly medically complex population of seniors requiring high levels of intensive care. The changes that are taking place also negatively affect recruiting new talent and retaining good employees. It's like there's a lot against keeping good people at work. The bottom line, though, is that high turnover, poor retention, low recruitment threatens a lot, but it mainly threatens the very quality of care and the quality of life that seniors deserve, right? So we have to take this topic very, very seriously. Ask any direct care professional in senior care today, right now, tomorrow, how difficult his or her job may be, and they may provide any number of responses, including what I found in the research. But I know so many direct care staff members, and they have said these types of things to me for years, by the way. Their job is difficult because of job-related physical pain and injury, or even risk of injury, intensive relational skills, and emotional labor. Being a nursing assistant is emotionally draining. Increased acuity of resident conditions, challenging behaviors due to Alzheimer's disease and other dementias or mental disorders, heavy workloads due to high turnover, working short, working skinny, call it whatever it is, it's working with fewer bodies, scheduling challenges, limited training and career advancement prospects. And here's one that's a real touchy issue. I know it. Inadequate supervision and management. I've always said this. People don't leave organizations or buildings or abstract companies. They leave the manager or supervisor who is right over them in the hierarchy of power and control. So it's not difficult to understand why there is a current crisis, and there is. Turnover is higher than it's ever been before. I'm looking at numbers. So say 10 years ago, turnover was 30 to 55%, maybe for nursing assistants as high as 80%, annually speaking. I'm reading reports that are blowing my mind. Turnover is over 120, 130% annually. That's crazy. We are literally bleeding great talent all the time, every single day. So it's not difficult to understand why there's a current crisis in recruiting and maintaining a stable workforce among direct care staff and senior care. But consider this: COVID-19 magnified, really brought out to the entire nation, by the way, just how important frontline staff are and how difficult and draining and painful that this job is on a daily basis. I can't say these wonderful things came out of COVID, but I think it has taught us that these are highly valuable people. They work hard every single day. They hurt in many different ways. Senior care companies would not have survived through COVID-19 without direct care staff, period. Nor would the older adults who made it through the pandemic be here today. Now, although hazard pay, you know what that is? It's an increase because you're working under hazardous conditions, was offered to many caregivers at very high rates. It was indeed possible for a while. If senior care companies were willing to pay more to direct care staff through a crisis, isn't there some way to reconfigure a new baseline wage for these crucial employees? I'll end on that question. Keep coming back. I'm Dr. Jim. See you, leaders in healthcare. Take care.